Hi everybody, this is Sultana Nosrati and I'm an LCSW. Welcome back. First, I really wanted to thank everybody for their support. Some of you have asked me to keep recording. Sorry about the delay. There's been a lot going on. So without further ado, let's get to today's topic. Today's topic is actually very near and dear to my heart. It's all about grief. Different things that you can do, different things that you should know about grief, whether you recently suffered a loss or you're trying to provide comfort to somebody that has lost someone recently. So the first thing I want to talk about is the stages of grief. So if you've been around at all in society and have seen these movies about death and loss, you hear about the 5 stages of grief. And for those of you that don't know, they're denial, anger, bargaining, depression, and acceptance, right? So there's this thought process, or at least there was this thought process, that this goes by order. The truth is, and the reality of it is, which I definitely noticed when I started providing psychotherapy, and that is that there is no real order. And while for some people it goes just like clockwork, that's the order of their grief. For a lot of us, that is not how that works. Some of us don't experience all of these steps. Some of us experience all the steps, but they happen in different order. They skip completely, or our grief looks nothing like it. So because it's not really reliable, I don't really talk about stages of grief when I talk to my patients. What I do want to talk about is that whatever you're experiencing, if you have lost somebody that you really care about, it's going to be very unique to you, and a lot has to do with the relationship that you had with the person that you lost. So if you find out that your ex-husband that you were married to for 10 years died, and you haven't spoken to each other in 20 years, you're not going to really experience that sense of loss or grief. And if you might, it might look very different than if you found out you recently lost a sibling that you love very much and talk to all the time. So the idea that grief takes a certain pattern is not really true, and it's not really based in personal experience. So that's what the most important thing I wanted to start off with, and that is everybody's grief is going to look very, very different. So some helpful things for you to do when you find out that someone you're close to is dying. So there's been a lot of cases of COVID recently, but I also see a lot of cases where they find out that their sibling, their child, or their family member is dying of cancer, or their stage 4 cancer, and the chances are that this person might pass. So if you know and you have this golden opportunity and you know that you might not have this person in your life forever, one of the things that I highly recommend my patients do is take the time to make a video. So you want pictures, which is great because it helps keep that person fresh in your mind forever, but you also want audio and video so that you can keep that person in the way that you want to in your memories. The biggest thing I hear about regret from patients that have lost somebody is that they don't have anything left. They have these things that they've inherited, or they have these pictures they're looking at, but they're terrified they're going to forget the sound, or the sound of the person's laughter, or the sound of their voice. And so I always say, keep a memento. Personally, I have messages from everybody in my life that I really love that I've saved because you never know. And I like knowing that I have a recording of them somewhere. Although these days videos are quite common, right? The other thing you want to make sure you're doing is, a lot of people get stuck on, this person is suffering from cancer and they're probably not going to make it. And so they're already pre-prepping for the loss. My suggestion is, try not to do that. Stay in the moment. Make the best of it. Don't make it about the fact that they're dying. Make it about the fact that they're here right now, and you can enjoy them, and you can love them, and you can hug them and get as many kisses as you possibly can. Although COVID again makes it a little hard because if the person's in the hospital, you can't really see them as often as you want. But the point is, take advantage of all of the opportunities presented to you, because that is what's going to hold you when they're gone. Now, what are some things that I want to make sure that you kind of have an idea about is, if you're not the person that lost someone, but someone that you care about deeply recently lost someone, there's some do's and don'ts I highly recommend you take into account, although again, everything is about the personal experience. Rely on your knowledge of that person and what they would prefer, what they would want. So this is just some tips. They're not like exclusive, and if you don't do this, it's not going to go well. No, it's just meant to really be helpful. So be supportive and let them know that you're here. It's really that simple sometimes. People feel at loss for words and they're trying to find the words, and sometimes it comes out really awkward. Don't do that. Just let them know that you're offering your condolences and that you're here if they need you. Check in on them every once in a while to make sure that they're still okay, and if there's anything they need, you're still here. But that's one of the best ways to start. The other thing is help out by doing the little things around the house, especially if you have that kind of relationship that you normally realize this person would have to do, but they're not in a place where they can. So that's one of the ways that you can kind of make it a little bit easier. It's not like they're going to be like, yes, thanks so much for doing my dishes. I really appreciate that. But it's helpful because it's one less thing that they have to worry about, and it gives them more time and opportunity to grieve. Don't ever tell somebody that the person they lost is in a better place. I know it sounds good to say, but this person just lost someone that mattered a great deal. You don't know that this other person is in a great place. I mean, yes, accounting for religion, and some people feel very strongly about that, and I'm certainly not discounting that. But again, you really should know the person very well. And most of the people that I treat that have lost someone that mattered to them, that infuriates them, especially when the patient I have lost a child. The other thing that they really don't like, and that I've heard quite often, is when someone tries to make them feel better by saying, well, at least you have this other child, or hey, at least you have your husband. It doesn't matter. They just lost someone that was extremely important in their lives. And no, it's not feeling good to know that, yeah, at least you've got this. The point is grief, and you've got to give it the time that it needs, period. Sometimes the best thing you could do is to just be quiet. Now, I, and those people that know me, know that I'm kind of a talkative woman. I talk a lot. And I had to learn this the hard way. When someone close to me lost someone that was very close to them, the best thing I could have done, and the best thing I've learned to do, is to just be quiet. Be there. Be that presence sitting next to them, and comfort them whichever way you can. But sometimes the best thing that you could do is just let them talk or not, and just be that presence right there with them. The other thing I've heard, and this is most common, something I hear from folks that have lost children, is especially if the child died when they were young, other people in their lives originally, when the first loss happens, they attend the funeral, they drop off pastries, and they do all this stuff. But as time goes by, they find themselves avoiding the topic, thinking it's too painful for the person who lost to talk about. Actually, it feels like you're ignoring them. So if someone lost their child and they want to talk about it, don't avoid the topic, even if it's been 5 to 10 years. I had a patient who lost a very young child due to an unfortunate set of circumstances. And she had pictures of her son everywhere. He was 5 at the time that he died. And other family members started taking the pictures down, not from her house, but from their house. And so when she would go over, it was like this elephant in the room. Nobody wanted to talk about the fact that this child existed and he was important. And all she wanted to do was talk about him, but she felt like she couldn't because it would make other people uncomfortable. So be open to the idea that somebody is going to want to talk about the person that they lost, even though it's been years, even though the loss was painful. For a lot of my patients, this feels so comforting to know that they have the space and time to talk about their lost loved one. So it's important. The other thing I will say is if you are grieving, take the time that you need. And guess what? Like this debunked theory about the 5 stages of grief, it's not a set time. For some people, they just need a few days if it's someone that they didn't really have a good relationship with. But when you lose somebody that's important to you, The idea that you're somehow going to get past it and time heals all wounds is very self-defeating, because what if a year or two has passed and it's still super painful? So what? That means you're abnormal? No, it just means that it's going to take the time that it's going to take. And ignoring the way you feel only leads to trouble. Things like going from grief to serious depression or anxiety. That's where that comes from. Anger even comes from this. You feel how you feel. Acknowledge it, process it, and know how to find the support that you need. If you need extra help, it's okay. It just means that you're human. It doesn't mean that somehow you're not tough enough or somehow there's something wrong with you because it's taking you longer. It is what it is. And a rule of thumb that I've always given my patients, and those of you who are my patients probably are going to chuckle at this, but the truth is, whatever works. Do whatever works, as long as it's not hurting anyone. Remember, you are a person. And as long as it's not illegal. If it helps you cope with some very real loss, go for it. It's all good. Now, there's some rituals that sometimes can help with the loss. So, for example, culturally, for us, for me and my family, when we lose somebody that matters, for 7 days, you don't go anywhere, you don't do anything, you just give yourself the time that you need to process. And then there's different times after the loss that you take the time to mourn or take the time to remember the person. So for us, it's a 30 days after, and then 6 months, and then every year in the year, including the first year. So there's different things that we do, like we light a candle that lasts for 24 hours as a way to remember that person's loss. I generally do it on their birthday or the date of their death, just as a way of kind of paying my respects to that person and keeping them fresh in my memory. For other people, some cultures don't cut their hair for a year after. Not that this is something that I'm saying you should do this, but for a lot of people, having a ritual that is meant to pay respects to the person that they lost is helpful in the grieving process. And finally, time makes it more bearable. It gives you practice in living your life without this person. But it doesn't always heal all wounds. And so sometimes if it doesn't, it can make you feel like there's something wrong with you. And the purpose of this video is to tell you no. Every grief, every loss is unique. And there's so much that goes into it. It's just not that simple. So if you need help, reach out. If you need to talk to a friend, reach out. If you are the person who sees someone else has lost, don't forget them after 30 days when the funeral flowers have all gone and the burial is done. They still lost someone that matters to them. So checking in on them every once in a while is important. Remembering anniversary dates is important, and it's helpful. And it lets that person know that they matter. So I hope that you found this helpful today. And if you have any comments or questions, please feel free to reach out to me. And if you like this video, please hit like and subscribe. Hope you have a nice day. Bye.